Concern is growing over the numbers of young people being affected by the coronavirus resurgence as they head back to school. One US study shows hospital admissions for paediatric patients have more than doubled.
Children, once considered relatively safe from COVID-19, are being hospitalized with severe cases in increasing numbers, occupying as many as 1 in 5 beds in some Texas pediatric hospitals.
Where we have higher rates of infection among children is where we have lower rates of vaccination in general.
Pediatric patients now represent 3.5% of all hospitalizations in the U.S., more than twice the figure earlier in the pandemic, according to St. Jude Children's Research Hospital. In the past week, COVID hospitalizations for all ages increased nearly 37%, with more than 62,000 Americans occupying increasingly precious beds. In Mississippi, which has one of the lowest vaccination rates in the country, the federal government is staffing a 50-bed field hospital to relieve some of the pressure on crowded medical facilities.
Our ICUs today are full. Our patient beds are full. So, we continue to be in that situation where the bed capacity is extremely tight.
The FDA authorized and the CDC recommended a third dose of Pfizer and Moderna vaccines for people with weak immune systems. Boosters for healthy individuals may come later if the Delta variant shows more resistance to the standard 2-dose regimen. In one study awaiting peer review, Mayo Clinic researchers estimate that by July, the Moderna vaccine's effectiveness against COVID infection had declined to 76% and the Pfizer vaccine to 42%. However, both vaccines continued robust protection against severe illness and death.
With Delta, people, even though we're vaccinated and we have good immune systems, this virus can cause mild infections, akin to a common cold, or it might even put you in bed for a day or two. But you don't have to go into the hospital.
Today, Chicago Public Schools announced all of its employees must be fully vaccinated against COVID-19 by October 15. Those with religious or medical exemptions must undergo routine testing throughout the year.